one and only, the end hearing of a series of 13 hearings and conducted by the Joint Fiscal Committees of the Legislature regarding the Governor's proposed budget for fiscal year 2014-2015. The hearings are conducted pursuant to Article 7, Section 3 of the Constitution and Article 2, Section 31 and 32A of the legislative law. Next, Fran Turner, Legislative and Political Action Director, CSEA.
Good. I'm only going to be here for a minute because I have, we decided this year that we would bring our direct frontline workers in from both the state and local governments to talk about what's going on in their fields. And I would only open with this. For the past 9 years, 10 years, our members have been asked to do more with less. And with the past few budgets and losing over 90,000 public sector employees, which I didn't hear the Department of Labor talk about, our members can no longer do more with less. So I would appreciate it if you give your attention to them. I'm going to step away and they can speak to their agencies and the services they provide.
Good afternoon.
Good afternoon.
My name is Kathy Button, and I am a 45-year employee of OPWDD.
Excuse me. Could you help, Fran, why don't you sit up here with the, would you help Fran move the chair, please? And do you have my nameplate?
Go ahead.
My nameplate?
I'm very grateful to have this opportunity to speak on behalf of all the direct care staff that work for OPWDD. During my career, I've been through many changes with this agency. I've been through layoffs, closure of Craig Developmental Center, Newark Developmental Center, 2 consolidations, and now the closure of Monroe Developmental Center. I worked with management to provide the safety for our individuals as well as the training for employees and the community that they were being placed in. The closure of Monroe, D.C. was done in a very disheartening way. The individuals being placed in the community homes for the Monroe, D.C. have special needs, behavior problems, and some are pedophiles that require special trained direct care staff to take care of them. When Craig and Newark closed, CSA and management worked together to make a smooth transition, making sure that the individuals were provided with trained staff, that the community was well informed what type of individuals were going to be placed next door to them, and if there was any problems, they were told the numbers to call so that things could be immediately taken care of. Now it's a hit and miss. Neighbors now call the union to ask why the pedophiles are living next door, and they have small children and are deeply concerned and ask, what can we do? Who should we call? Voluntary agencies are already calling regarding certain individuals and want to know if we can take them back. CSEA had questioned the closure. Why are we rushing and acting like we're closing a business instead of a center where we have so many special needs? And this is their home. Their reply was, we are doing what we were told. Is this what OPW means when they say we put people first? Instead, the individuals were moved 2 days before Christmas and the day after. They traveled with staff they didn't know in places far away from where they used to live. They went with no program plan for staff to follow to protect their needs, and they went there with half the staffing ratio they had at the center. The ratio at the center was 2 to 1. Now they have 0.5 per individual. They have untrained staff to take care of them. Their plans were changed so they could be placed in the community, but their behavior was the same, and some took advantage of that situation. On paper, they looked like they could make it. But our question was, what changed? How did they change on Tuesday with 2 staff, and on Wednesday they only needed 1? The question was continuously without a response. The direct care staff are dedicated people. They were now not hired to work 16 hours a day. They were not hired to drive individuals around in a van for several hours because of their acting out behavior, and due to that behavior, they could not participate in day programs, nor could they go to a restaurant because there wasn't enough staff. The staff were not prepared to run out on the highway to chase individuals when they escaped due to the staffing shortage. The staff were not prepared to be reassigned 45 miles away from their last work location because they were told if you didn't like it, you can quit. What the direct care staff were hired for was to provide care to the individuals, follow the programs, groom them into the community, and educate the community that they too could be part of their activities. Under managed care, the services provided by the state employees will diminish. We have heard from parents across the state that they are fearful that their loved ones will not get the care they need. It is too late to repair the damage that's been done with the closure, but it's not too late to make damn sure that other closures have a partnership relationship to work together like they started to do in the beginning. Unless you have worked with the special needs people, don't assume what you're being told is the right way. Listen to some of us that have been through this more than once. I would like to add, in listening to all day, because this is my first time going through various hearings and testimonies, I'd like to add that when the DC closed, we had food service people, grade 5 and grade 6. What was offered to them was an ARTL. They stay on that ARTL until they get a job in 2 years, or they don't get anything. Their jobs that they were offered to move to were in Brooklyn and Binghamton. They live in Rochester. We have people, 3 of them, that are driving to Brockport because they didn't want to lose out. So what sometimes you hear really isn't what's going on. Thank you for your time.
Thank you.
Good afternoon. My name is Abraham Benjamin. I'm a Secure Care Treatment Assistant 2 at Bronx Psychiatric Center. As of March 18th of this year, I will have been blessed to have given service to our individuals for 33 years. When I first started, I was used to revel at the accomplishments and being invited to college graduations and weddings of our individuals. In the past 10 years approximately, I have witnessed and fought about our individuals being pushed out without skills to succeed in the community. Skills, you may ask: grooming skills, GED, interviewing skills, and medication education, for example. I'll give you a few examples where we fall short in preparing our individuals in 4 types of community programs. The first type, our transitional living residents. We have a blind resident who needs one-to-one assistance where there is no services for the blind. On those units, you have 1 to 2 staff members that will be responsible for 15 to 24 individuals. In this transitional residence, we have combative individuals that have assaulted peers, busting one's nose and causing many head injuries. I'm aware of several individuals in the inpatient who were assaulted and then 2 days later was put into one of those transitional residence programs. Our community transitional program, we have a resident who exposes himself to the staff and also attempted to rape a staff, and they're allowed to leave and go out into the community. We have residents that cut one of his peers talking about they talked to his girlfriend 6 months prior. A male resident who threw himself in front of the 6 train and is in a coma, the last we heard. A female resident who jumped off the Brooklyn Bridge and killed herself. Our outpatient clinic. Our individuals aren't appropriately given skills because they go out inappropriately dressed for the weather. You will find them in all the snow with flip-flops, pajamas. Clients do not blend into the community and stand out. They do not have good personal hygiene skills as evidenced in their disheveled appearance and foul body odor. Our clients are not taught how to travel skills, to discharge, to attend programs and medical appointments. Our individuals are not properly referred to suitable programs, i.e. MICA. We have an outpatient program where we have a lot of sexual offenders, traumas, and alcoholic and drug abuse, but there is no MICA program at that clinic. There's rampant drug and alcohol use with no MICA programs. Family care. Family care is where a family takes in a mentally ill client to have them in a family setting. I feel it's used as a dumping ground for the individuals who are inappropriate for discharge. Those providers have a lack of proper training and or retraining on how to deal with the mentally ill. Who follows them when they go out in the community? ICM workers that have an overload case load. Many individuals fall through the cracks. Families and individuals call myself and some of my colleagues to help them come back. And at times it's very difficult for those individuals to get help. In my opinion, it appears at times our individuals are being used as a revolving door for discharges and admissions for just number purposes. I say this because individuals are sent out to the community without the skills to succeed. I would like to thank you for allowing me to speak on behalf of my colleagues and also on behalf of the individuals we serve.
Good afternoon, and thank you for this opportunity to speak. My name is Ron Briggs, and I am here today as a probation officer, member of CSEA, and a lifelong resident of New York State. When I was 3, my father, the sole financial provider for our family, died, leaving behind my mother and a sister and 2 brothers to be cared for. Our family thrived because of the support and opportunities afforded us by New York State, ranging from food stamps and health insurance to becoming a proud graduate of our SUNY system. My success story is not unique because of our state's commitment to all, but the story is in jeopardy because of our governor's continued commitment to a few. As the local president of CSA in Fulton County, I have a working relationship with the local elected officials and our county administrator, John Stead. Recently, when discussing the budget with Mr. Stead, he pointed out that if the governor wanted to help, he would increase the aim that has remained stagnant and for the last year and have taken several hits in the last couple of years. Our county made some drastic cuts to services, which Senator Farley can certainly testify to, which even Mr. Stead agrees were not popular. These cuts include the outsourcing of our nursing home, mental health, and addiction services. If this budget passes as is, how will Fulton County continue to survive? Sound bites like tax freeze are wonderful, but they do not make effective policy. As a community member, I hear the governor explain how he would like to help local governments and school districts. Yet the soundbite policies placed in this budget actually hurt our local community. I've worked for the last 20 years for Fulton County, first as a child protective worker and the last 8 years as a probation officer. In my office, there has been a 30% reduction in the number of officers. Higher caseloads with less services in the community. It is a formula for disaster. I was assigned a probationer as a result of a felony DWI. In working with this gentleman, it became apparent that not only did he have substance issues, but he also had mental health issues. His mental health issues were so prevalent that he was receiving disability. I directed him to obtain an evaluation from our recently outsourced addiction clinic. However, I was told that the clinic would not service him as he was too aggressive. Although he was attending therapy at the mental health clinic, he was not going often. After all, he is mentally ill. He was not on medication, nor was he receiving any services. Fast forward an entire year, and this probationer has just started to receive other services, but is still not on medication. During that last year, the probationer went into a grocery store, walked in, stole a 30-pack of beer, and walked out. Arriving back at his friend's house, some issues surfaced, which caused him to become erratic. He ended up walking to the police station and turning himself in for stealing that beer. He was arrested and a violation of probation is pending. The easy answer for me and other officers in my predicament would be to send him to jail for the crime. But as any county sheriff will tell you, our jails are filled with mentally ill. Wouldn't services for his mental health be more appropriate and humane response to the problem? If this budget passes without significant changes, it is very possible that this person, along with many others, will end up in jail because services are disappearing. This budget would increase the risk to our community while costing the taxpayers more. Helping people make better choices takes services in our community. Helping people raise themselves out of poverty takes services in our community. Helping young people in our community become better citizens takes services in our community. Unfortunately, in Fulton County, this is becoming more and more difficult to offer because of the stranglehold the governor is placing around our necks with the state budgets he offers. I ask that you stand up for what is fair. A tax freeze sounds good in an election year, but the strings attached are such that the local governments would be forced to cut what is left of services in our community. In Fulton County, we've had school districts that merge, and we've had school districts that have voted not to merge. Isn't that the way it should be done, based on the community members, not by the governor bullying us into something by cutting off funding streams? I understand you will hear from many different constituency groups, and I think if you listen closely, you will hear similar concerns. My experience in Fulton County is not unlike what my brothers and sisters experience in other counties. What each one of you says is important, but what each one of you does to make this budget better is more important. Our communities need you. We ask that you stand up to make the necessary changes so local governments and services don't disappear. Thank you for your time.
Thank you.
Good afternoon in my notes, but it appears good evening would be more appropriate at this time. My name is Glenn Tufel. I'm a casework supervisor with the Nassau County Department of Social Services. I've been working for the Nassau County Department of Social Services for the last 19 years in child protective services and in adult protective services. I'd like to discuss a little about how I came to choose a career with the Nassau County Department of Social Services, and I am using the word career and not a job. In my educational background, I studied psychology and social work. And a long time ago, when I took this job, I really found a home and a place where I believed I could make a difference. In a field where usually only your mistakes get attention, I know that I've made a difference over the years, and that my colleagues have as well, in providing vital services to the most vulnerable people in our society and in our county. Excuse me. However, over the last approximately 10 years, I've seen a real dramatic change in the services, not only at the Department of Social Services, but in local government in general. Some of the challenges we faced are through attrition and layoffs and budget cuts. We've seen staffing go dramatically down in Nassau County. We've repeatedly been asked to do more with less, and we have to the best of our ability. But I would ask you, is there not a limit to this? And have we not reached it? The county executive in Nassau County, Ed Mangano, frequently touts that the workforce in Nassau County is the lowest since 1950. This is in a county where at the time the population was approximately 400,000, is now approaching 1.4 million. Does it not make sense that this staffing should address the needs of the population? At my building, the Nassau County Department of Social Services, there are frequently lines of an hour to an hour and a half just to get through the metal detectors to get into the building. People coming in for emergency housing, Medicaid, public assistance, food stamps, and services frequently then spend the entire day in the building awaiting their number to be called, only then to be told to come back the next day as there is inadequate staffing to address their needs today. Increases in caseloads in food stamps, Medicaid, and public assistance have reached such drastic levels that we now have workers assigned 500 caseloads in Nassau County. Also in services where you're dealing with CPS, Adult Protective Services, and foster care, despite federal recommendations of 12 to 15 cases, we have caseworkers that have better than 30 and some with better than 40. The current response of local government has been to continue to squeeze and then to subcontract and outsource because the workforce is not sufficient to address the needs that need to get done. This subcontracting and outsourcing, at least in my department, has revolved around preventive services, foster care, child support, PINS, and juvenile delinquent services. What winds up happening is these services are subcontracted out to agencies who use staff that they can hire for very little money or interns. The services become subpar, and the same families wind up coming back to DSS for similar problems and creating a revolving door policy. I would state to you that this problem-solving technique, although easier, is certainly not better. Employees can no longer find careers in the Department of Social Services and in local government. These are some of the challenges that we faced, and I would like to challenge this legislative body to see what they can do to stop this. More and more cuts do not equal more and more success. We are not meeting the minimum degree of care, not only in the Department of Social Services, but all throughout local government in Nassau County. We have instances in Nassau County when we've had one 911 operator for a population of 1.4 million people working on one occasion. We've had insufficient ambulances. We have insufficient probation officers. The frequent response that we get not only from this legislature but from other legislative bodies is unfunded mandates. In DSS we see this where you must see a child in a CPS report within 24 hours, or applications for food stamps and Medicaid and public assistance must be completed within a certain number of days. But these unfunded mandates do not address the fact that there is insufficient staff to get these jobs done and to ensure that these services are being provided. I would like to challenge you to find the funds necessary to fund these services. Employees, not only do the employees become vested in careers, but what happens with subcontracting to third parties is you wind up with less and less parties, less and less employees able to become functional constituents and have careers. These same employees who are subcontracted wind up creating part of the problem that we're here to fix. They create a larger class disparity and increased wage disparity, and it helps destroy the middle class. Not only are we employees, but we're also taxpayers and constituents, and our taxes help fund this government. In closing, I would like to ask that you avoid the low-hanging fruit of just plucking labor costs to continue to lower the services that are provided, and that at some point you try to climb the tree and find more creative ways to fund these services and continue to provide careers for individuals who wish to provide them. Thank you.
Thank you very much. Questions, Senator?
Thank you. Chairman Farrell, before the questions, I'd like to welcome and join the panel the distinguished Senator Hugh Farley. Senator Farley. Any questions of senators? Senator Savino.
Thank you, Senator Nozzolio. Thank you for your testimony. The only thing I wish we had heard it before the previous two commissioners had spoken. As you heard while you were sitting here, one of the questions that I've been posing to them is how are we managing to do the work in these agencies with a shrinking workforce and an aging workforce? Not that any of you are old, but, you know, like you, I started 24 years ago, I feel a lot older now, as a caseworker in the city's child welfare system. And as you know, some of these jobs, these are young people's jobs. Certainly we want people with experience, but the amount of hours that go into them and the stress that it places on an individual dealing with families in crisis There's a reason why you have a lot of we're not seeing young people going into this profession. So I was hoping you could tell me a bit about what the current caseloads are like, let's just say in social services in Suffolk County.
I'm in Nassau County.
I'm sorry, Nassau
correct,
County.
so I'll speak to that. But the current caseloads for investigative caseworkers in child protective services range in the 30 to 40 range, even though there are federal guidelines that state, 12 to 15 investigations.
These are active cases or pending reports?
These are active investigations, yeah.
What's the average number of pending reports that come into a unit? Are you getting 10 new pending?
Oh, you get, each, we have a variety of units in Nassau County. Each unit gets, 3-4 reports a day. So usually workers are getting almost a report a day. I mean, so you get a report a day, and that's whether you're there or whether you're not there. If you're on vacation, you still get reports.
What I'm always concerned about when that happens is you put tremendous strain on the casework staff, particularly on the CPS staff, to perform in too many cases, and it leads them to make decisions that if they had all the resources they might not arrive at. I'm always concerned about I shouldn't say inappropriate, or decision to remove a child because you don't have the ability to monitor that family and provide the services as closely as you could if you had a lower caseload. Are you seeing a rise in out-of-home placements?
No, I don't believe there actually is. There's actually a trend away from that. There is a tremendous amount of pressure, though, on these caseworkers to get these determinations done. And what I believe is the outcome of some of this is that cases are being prematurely closed.
That would be a serious problem, because we don't want to indicate them unnecessarily or unfound them unnecessarily. There are some pieces of legislation that have been introduced in the Senate and in the Assembly, I think, that would speed up the time for CPS workers to arrive at that decision from the current 60 days to 30 days. I would think that would place a tremendous strain on your workforce. Do you not agree?
Without additional staff, it would absolutely create a lot of strain and a lot of administrative pressure on that workforce to make determinations in an amount of time that I believe we wouldn't be able to with our current staffing levels.
And in the developmental disabilities, what's the amount of overtime that we're seeing workers have to put in there? What, on average, what's an hour a week for a worker in OPWDD?
That's you,
For OPWDD?
Yeah, up to the mic.
Depends upon what home. But the worst homes, I would say that the direct care, they could work 2 shifts, 3 days in a row. That's what they're doing.
Days,
they don't, when they go to
3 days in a
work,
row.
they don't know when they're going to come home. And that's the God's honest truth.
This is an outrageous way to provide services to vulnerable populations, whether it's mental health services, child protective services, probationary services, and oftentimes the same population you're dealing with, cross-systemization.
For OPW, and I will say this, we have probably close to 375 people on administrative leave, which creates, every one person creates 3 shifts of overtime. So that in itself creates a lot, besides your workers' comp, where people are getting hurt because there's not enough people working alongside of them with some of the individuals that have been placed in these homes that came from the closing of MDC.
But that was going to be the next question, the number of workers' comp cases, assaults on the job, inadequate protections at the job site. Can you, either of you, share what you're seeing at the work sites?
Well, the individuals that we have, sometimes they get violent, but our biggest problem is that we're not giving them skills to deal with their issues in a proper way for society. On top of that, in the last 3 to 4 years, we've had a shortness of staff, and they actually reduced our staff, our direct care staff, our direct care in dealing with the individuals, and also in our food service department. So that's a rise in overtime. And sometimes our individual act out because they're scared, because they don't feel that they have enough protection because there's not enough staff. So if they assault someone, then they're on a one-to-one, and then they know they have someone who's going to definitely be watching them to protect them from somebody else taking advantage of them. So there's a lot of things that go into that, and it doesn't seem like people are seeing the big picture. I would love for our individuals to go into the community but I want them to go out there the right way. And the problem is that pushing them out there with not giving them the skills. When I first got into this business, I was actually happy to watch my individuals succeed. Some of them now are my co-workers. We will hang out, we will talk, we will have conversations. They're worried what's going to happen in the future because there'll be nobody there to help someone else get better.
I just want to thank you all for putting, a real human face on what these budget cuts have meant to service provision, especially in the vulnerable populations that we know that depend upon the state and the counties for these particular services. Thank you.
Thank you, Senator Savino. Senator Farley.
Yes, I just want to say how deeply moved I was by your testimony, Fran, and also my Fulton County constituent. And I'm well aware of all of those problems that exist out there. And I thank you for your service, particularly for your people, what they do for New York State. That's it.
Thank you, Senator Farley. I just have a comment and observation. I'd certainly share Senator Savino's analysis, and you really have put a good picture, a clearer picture on the impact. At public protection hearing, we looked at the displacement of workers at the closure of 6 facilities across the state. It's about the 600 range, and about, I'd say, 10 to 20% of them are CSEA. The other, Discoba and PEF, make up the remainder. Ms. Turner, have you had any opportunity to see the total employee impact in terms of displacements across the state on all sectors?
I don't have a cumulative report. I can tell you that all of our members from the corrections and from OPW are not being placed, regardless of what you heard through this ARTL process. They are not being placed. Well, I shouldn't say they're not being placed. I can offer you a job from Rochester to Brooklyn, and they will say, we offered you something. We would say that's a forced layoff, because there are very few families that can afford to just pick up and move and go to Brooklyn. One of the things that we have asked and talked to the governor's office about is perhaps delaying some of these transfers until at least after the school year, because maybe some people would be willing to move and relocate, but they have families. And it's not that easy. Many times in the CSEA workforce, there's husband and wives that are both in the state workforce or the local government workforce or in public service. So it's not easy to go from Finger Lakes, New York to Brooklyn. And a lot of what we're seeing in OPW, that's where the jobs are. They'll offer a cook a job, grade 5, it's 200 miles away. So I wouldn't say that it is perfect by any means. Not everyone's getting placed.
And as you further develop numbers, please share them with us.
Absolutely, I will do that. And you know, one thing, Senator, that you might be helpful with, I think that they need to think outside the box a little bit more and be a little more creative in where they can place these people. I did listen to Mike Belforte and thought they haven't gone far enough in what they can look at. For instance, some of the OPW people, the cooks could probably be placed in OCFS, but they haven't approached OCFS to say, hey, do you need these people? Could they move into your agency? I think they need to make more of an effort that way, and certainly we will work with them. I will say this. One of the other problems is, you know, when this consolidation, merger, closure, whatever was going on, the governor promised no layoffs. So a lot of our members won't go through that ARTL process because they're listening to the director of their facility saying, we promised you no layoff, so they think they don't have to go through that ARTL process to bid on a new job, okay? So they're not being educated on, you do have to go through the ARTL process if you're trying to retain a job in the area. We were also promised that our members in OPW would be able to stay in the same DDSO, and it's not happening. But I'll get you those numbers.
And also, as maybe a reflection of the prior transitions, and you've already commented about the significant problems there, but thank you very much. Any other questions, Senators? Thank you.
Thank you very much.
Thank you.